Hi everyone, welcome to this quick but powerful revision session on parasitology, eggs and cyst. It is a must watch for NEET PG, INI-CET and FMGE aspirants. As NEET PG is approaching, so we will revise the identifying features, mnemonics and high yield facts of important parasitic eggs and cyst, all in one go with images. So let's start our today's video. So first one is Entamoeba histolytica. So Entamoeba histolytica is a pathogenic amoeba. Please remember it is a pathogenic amoeba and it has 4 nuclei. So we call it as quadrinucleate cyst. The trophozoite form of this amoeba, it engulfs RBC and it is the diagnostic feature of Entamoeba histolytica. It is seen with stool of patients with amoebic dysentery. And the identifying feature it has one chromatid bar. Now the other one is Entamoeba coli. The Entamoeba coli has 8 nuclei and it is non-pathogenic. Entamoeba histolytica is pathogenic amoeba and Entamoeba coli, and there is one more Entamoeba dispar. These both are non-pathogenic, and it has more than like around 8 nuclei, and it has multiple chromatid bars. So the mnemonic for remembering Entamoeba coli is that there are 8 nuclei. So coli has crowd. There are multiple nuclei, so it is a crowd of nuclei. Now let's move on to the image of Entamoeba coli in the stool. This is how Entamoeba coli appears in the stool image. Second parasite is Endolimax nana, and in Endolimax nana it has 4 nuclei. The karyosome is bloat-like. There is no peripheral chromatin, and this is the cyst wall, and it is the cytoplasm of which some few granules. The main identifying feature is that the bloat-like karyosome which appears in the stool microscopy. It is the smallest amoeba, and the mnemonic is nana is tiny. The third one is Giardia lamblia. It is the important parasite we have to remember. There are two forms. First one is trophozoite and second one is cyst. In the trophozoite form, it has 2 nuclei. There is a sucking disc, and there is a 2 nucleus, basal bodies of flagella, parabasal body, flagella which are of 4 pairs. Means total 8 flagella are present, 4 pairs. The shape is pear shaped, and the cyst has exostyle. There is a thick cyst wall, 4 nuclei, nucleolus and parabasal bodies. The main feature is 4 nuclei and it is of oval shape. The mnemonic is the old man, like these are the beard of old man, and it causes the fatty diarrhea, steatopia. The main cause is Giardia lamblia. Now next one is Diphyllobothrium latum. The main feature is that it has operculated egg and it has a small knob on the opposite side. This is the picture in which it is showing in the closed form in the stool microscopy. It causes megaloblastic anemia, B12 deficiency. Now next is H. nana, Hymenolepis nana. Hymenolepis nana, it floats in saturated salt solution. Please remember, it floats in the saturated salt solution and it has no intermediate host. H. nana has no intermediate host, and in the image we can see there are polar thickenings. It has polar filaments and the hooks are in 6 pair. This is the diagram of H. nana, and they are yolk granules. These are the yolk granules. And the inner membrane, outer membrane, oncosphere, hooklet, polar knob, and polar filament. Please remember there are 6 pair of hooks. Next is the, we can say, brother of H. nana, small brother, H. diminuta. It has no polar filaments, and there is a gelatinous material present inside the between the inner membrane and outer membrane. In there are yolk granules in H. nana between the outer and the inner, but there is gelatinous material in H. diminuta. Next one is Schistosoma. In Schistosoma, the main feature is the spine, presence of spine. The drug of choice for Schistosoma species is praziquantel. So there are 3 species, as we all know: Schistosoma mansoni, hematobium, and japonicum. In mansoni, the spine is lateral. There is lateral spine. We can remember is that like men are sideways. Men are always on the other side. So mansoni, men are on the other side. Hematobium is having terminal spine. Hematobium, T for terminal. So Schistosoma hematobium has terminal spine. In the japonicum, the spine is rudimentary. We can see a terminal spine which is like rudimentary spine, not terminal and not lateral. Next one is Fasciola hepatica. Fasciola hepatica, it is also a operculated egg, and it causes obstructive jaundice. This is the operculum, as we all can see. The snail is the intermediate host on the Fasciola hepatica life cycle. So there is a mnemonic we have for operculated eggs, STD. STD stands for S for Spirometra, D for all trematodes except Schistosoma, and D for Diphylobothrium latum. STD. Please remember this mnemonic. अब बात करते हैं Ascaris lumbricoids की. Ascaris lumbricoids has two eggs, unfertilized and fertilized. So the unfertilized egg has thin shell and it is kind of oval shaped, elongated, and there is heavy albuminous coating. There is amorphous mass of protoplasm and it is unembryonated. Whereas the fertilized egg is having thick chitin shell and it is of round shape. There is coarse mammillated albuminous material present and there is undeveloped unicellular embryo in the fertilized egg. The fertilized egg it floats in the saturated salt solution and it is the most common helminth in the worldwide. So we are coming to the end of the video, and this is the Trichuris trichura. Trichuris trichura is the most easy egg to identify in the stool. It is barrel shaped and in the ends it is having mucus plugs. And the main clinical feature is that it causes the rectal prolapse in the children. Okay, so I think it is the second last parasite, the Enterobius vermicularis. The Enterobius vermicularis is the plano-convex egg, and there is the larva inside the egg. Larva is sitting inside the egg, and the shape is plano-convex. It is plane on one side and convex on the other side. The diagnosis of Enterobius vermicularis is done by Scotch tape test, and it is common in children. So the today's last parasite is hookworm. Hookworm like Ankylostoma duodenale, and it is a clear egg with segmented ovum. It has 4 blastomeres, 4 segmented blastomeres. As we can all see, it is the main identifying feature of this hookworm egg. So there is a mnemonic for non-bile-stained eggs also, NEHA. N stands for Negator americanus, E for Enterobius vermicularis, H for H. nana, and A for Ankylostoma duodenale. So please remember this mnemonic also. I have told you 2 mnemonics: operculated eggs, STD, and non-bile-stained eggs, NEHA. STD stands for S for Spirometra, T for all trematodes except Schistosoma, and D for Diphylobothrium latum. And non-bile-stained eggs, NEHA, N for Negator americanus, E for Enterobius vermicularis, H. nana, and Ankylostoma duodenale. I hope you all like the video, and please revise this parasitology eggs, as there is some image-based question always in the NEET PG, identifying the egg feature. And if you like the video, please like and share and subscribe to the channel for more such high revision. Stay tuned. So keep studying, keep revising, and all the best for NEET PG. Thank you.